Bismillah ar-Rahman ar-Rahim. Dear student, we will take lecture 7 part C, anatomy of cranial nerve and orbital cavity. We start from this slide, the mandibular nerve اللي هو الفي3 of cranial nerve number 5. The branches, the mandibular nerve give of the following branches from the main trunk. This is the main trunk when exit from the foramen ovale. Give of the following branch from the main trunk before division. The muscular branches, this is the muscular branches which are afferent nerve for the following muscle: the medial pterygoid, the tensor tympani, tensor filipalatini, and give a sensory branch, meningeal branch called nervus spinosus, which supply the meninges. From the anterior division, this is the anterior division, give the masseteric nerve, which is a motor, deep temporal nerve, anterior and posterior motor, and lateral pterygoid nerve, a motor branch, and also part one sensory nerve, which is called the focal nerve. From the posterior division, the auriculotemporal, which arises by two branches encircling the middle meningeal artery, and this is a sensory, and the lingual nerve, which is a sensory. This is a lingual nerve, which is a sensory branch, and the inferior alveolar nerve, mixed nerve, contain inferior alveolar nerve, which is a sensory branch for the inferior set of the teeth, which exit from the foramen, submental foramen, asmental nerve. And its branch, mylohyoid branch, which is a motor, supply the anterior below of digastric and mylohyoid muscle. This close-up view show the picture in detail of the mandibular nerve. The motor supply of the mandibular nerve, V3 of cranial nerve 5, the masticatory muscle, a muscle of mastication, the masseter temporalis, medial and lateral pterygoid, and the mylohyoid number 2 muscle, anterior below of digastric muscle, tensor tympani muscle, tensor palatine muscle. All of these motor fiber, all of these branches are motor fiber for this muscle. This lateral view of skull show this is trigeminal ganglia with its branches. This is the ophthalmic, this is the maxillary, and this is the mandibular branch. This dermatome showing the distribution, sensory distribution of trigeminal nerve branches. This is the fish, the ophthalmic, and this is the maxillary, and this is dermatome of the mandibular. The facial nerve, cranial nerve number 7, the facial nerve attached to the lateral surface of the brainstem between the bones and medulla oblongata. It consists of large motor root and smaller sensory root called intermediate nerve. Enter the internal acoustic meatus in the vitreous part of the temporal bone. On reaching the medial wall of the middle ear, the tympanic cavity. On the medial ear tympanic cavity, the nerve swell to form a sensory geniculated ganglion. The nerve then descends through the stylomastoid foramen to the down to the neck. Then the facial nerve now passes forward through the parotid gland to its terminal distribution, 5 branches. Sharp bend, this is a sharp bend of the facial nerve in the tympanic cavity, called geniculated ganglia, sometimes called the geniculated ganglion, a sensory ganglion of cranial nerve number 7, while transversing the temporal bone within the facial canal. The cranial nerve give rise to the following branches: the greater petrosal nerve. This is the greater petrosal nerve, and a nerve to stapedius muscle, and the chorda tympani nerve. Then, after running the longest intraosseous course of the cranial nerve number 7 emerge from the cranium via stylomastoid foramen in the temporal bone. Give of the following branches in the posterior give the following branches: the posterior auricular branches pass behind the auricle to supply sensory sensation to the occipital area. then enter the parotid gland and form the parotid plexus, which give rise to the following 5 terminal motor branches to the muscle of facial expression: the temporal branch and zygomatic branch, vocal branch, marginal, mandibular, and cervical branch. This sagittal section, this is a nasal cavity. You see this is facial nerve in the tympanic cavity, called the geniculate ganglia, and this is a petrosal nerve. This trigeminal ganglia, and this is pterygopalatine ganglia. Give these nerve is the greater palatine and lesser palatine nerve, which pass through greater palatine and lesser palatine nerve, supply the heart palate. This close-up view. This is the trigeminal ganglia, and this is tympanic petrous part transected. This is bone transecting, showing tympanic cavity, and this is geniculated ganglia of the of the facial nerve. This internal acoustic meatus passes through it vestibulocochlear and facial nerve, and this is the jugular foramen, passes through it glossopharyngeal vagus nerve and spinal accessory nerve, and this is hypoglossal canal, passes through it hypoglossal nerve. This is a lateral view of the skull, normal lateralis, showing this is a site of exit of the facial nerve from the stylomastoid foramen, and give posterior auricular branch of the facial nerve, and this is a 5 branches in the parotid, and give 5 branches: the temporal branches, the zygomatic branches, the vocal branches, the mandibular branches, and the cervical branch. As the facial nerve is a nerve of second pharyngeal arch, the facial nerve supplies the striated muscle derived from its mesoiderum, mainly the muscle of facial expression and a auricular muscle. It also supplies the posterior belly of digastric muscle and the stylohyoid muscle and the stapedius muscle. Cranial nerve, facial nerve provide presynaptic parasympathetic fiber to the pterygopalatine ganglia for innervation of lacrimal gland to secrete motor to secrete lacrimal fluid, and to the submandibular ganglion for innervation of sublingual and submandibular salivary gland. The pterygopalatine ganglion is associated with maxillary nerve, cranial nerve number 2, cranial nerve V2 of trigeminal, which distribute its postsynaptic fiber, whereas the submandibular ganglion is associated with mandibular nerve, cranial nerve V3 of trigeminal. Now we come to the cranial nerve, vestibulocochlear. The function of vestibulocochlear, special sensory, special somatic efferent fiber come from this nerve and pass to the brain, to the auditory area. This is a special sensation of hearing and equilibrium, to convey a special sensation of hearing and equilibrium. This section looking to the this is internal, this is middle, this is tympanic cavity looking from behind to this is tympanic membrane looking to it from behind. This is Eustachian tube, and it is tensor tympani muscle which tends the tympanic cavity. The tympanic cavity, this is the posterior part of tympanic membrane, which transmit the male voice vibration from outside to the through this is ossicle, malleus, incus, stapedius to the vestibulocochlear nerve. This also a section show this is external auditory meatus. This is tympanic membrane, and this is ossicle, and this is the Eustachian tube. This is malleus, incus, stapedius. Malleus, incus, stapedius, ossicle. This is also the middle ear, showing this external auditory meatus, and this is a tympanic cavity, and this is vestibulocochlear nerve. This superior view showing this is a petrous part of temporal bone, where the semicircular canal and cochlear canal lie there, and this is part of vestibular nerve, and this is vestibular nerve, and this is cochlear nerve, which form vestibulocochlear nerve, cranial nerve number 8. This is a cochlear and the semicircular canal. The glossopharyngeal nerve, cranial nerve number 9. The glossopharyngeal nerve has its finger in quite few pieces. It just have few function, means the glossopharyngeal nerve does innervate muscle of interest, the stylopharyngeus muscle. Its action to elevate the pharynx during gag reflexes. The taste efferent from posterior 1/3, taste efferent from posterior 1/3 of the tongue. It travels along cranial nerve number 9 to the solitary nucleus. This nucleus that receives the taste information from anterior 2/3 via facial nerve. So the solitary nucleus receives information from anterior 2/3 via vagus and posterior 1/3 via glossopharyngeal nerve. Now cranial nerve number 10. Upon leaving the middle oblongata, vagus nerve extends through a jugular foramen, then pass into carotid sheath between the internal carotid artery and internal jugular vein down to the neck, chest, and the abdomen, and there where it contributes the innervation of viscera reaching the way to colon. The right and the left vagus nerve descend from cranial fold through jugular foramen, penetrating carotid sheath between internal and external carotid arteries, then pass posterior lateral to the common carotid artery. These branches of the vagus nerve, 10 branches, the anterior vagal trunk, posterior vagal trunk, which is responsible for the gastric secretion of stomach, and this is the recurrent laryngeal nerve, which is responsible for voice, supply vocal cord, which is responsible for voice. The function of the cranial of vagus nerve is supply the motor parasympathetic fiber to the all organ except the adrenal gland, from the neck down to the second segment of transverse column. The vagus nerve also supplies a few skeletal muscle, including the cricothyroid muscle, the palatine muscle, and the superior, middle, and inferior pharyngeal constrictor muscle of the pharynx, and muscle of the larynxal voice box. This picture shows the vagus nerve. The accessory nerve, cranial nerve number 11. Accessory nerve is this family. Red-headed step-child is an unwanted and not distinguished child. It is pure motor, only motor, and its nucleus isn't even in the brainstem. Its nuclei consist of lateral aspect of the ventral gray matter from C1 to C5. The rootlet emerge from the lateral cord and then snake back through the foramen magnum, so they can come together and pretend to be a cranial nerve by leaving through the jugular foramen. From there, it proceeds to the innervate the ipsilateral sternocleidomastoid and trapezius muscle in the neck. The function of the nerve is too obvious to explain, turning the head to the left and to the right side, and also to shrug a shoulder, to raise the shoulder joint, to shrug the shoulder joint. This picture showing this is spinal accessory nerve. From C1 to C5, and then pass through foramen magnum and appear in the jugular foramen to the neck supply. This is trapezius muscle and sternocleidomastoid muscle. Hypoglossal nerve move the tongue, but also has efferent function, transmitting proprioception information about the tongue to the chief sensory nucleus of the cranial nerve number trigeminal number 5. So when we are chewing the food, our tongue not bitten by our teeth. This is very important information. The proprioceptive information goes through hypoglossal nerve. The nucleus of cranial nerve lie in the dorsal medulla, and the fiber exits between the pyramid and the inferior olive. From there, the nerve passes through the hypoglossal canal on its way to the innervate the intrinsic tongue muscle, as well as the extrinsic tongue muscle, which are the genoglossus, styloglossus, and hyoglossus. This picture shows a hypoglossal nerve course. By end of this picture, we come to the end of the lecture. Goodbye.